Can you hear me? Great. All right. Let's see, sharing my screen. Thank you for that. It was very interesting. I've been loving these, all the presentations, but it's great to see so many different perspectives on the topic of COVID. I was feeling like my slides today are kind of anticlimactic, but hopefully you'll get something out of them. So I'm Kathyrn Sabella. I'm part of the Transitions to Adulthood Center for Research within iSPARC. I'm somewhat of a junior faculty member, and today I'm just going to share some of the preliminary data that we have on how young adults who already had mental health conditions prior to COVID are faring during the pandemic. This study is funded by NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research. So I guess just to contextualize this study is that we, prior to the pandemic, had been doing a longitudinal quantitative study of young adults with serious mental health conditions. The sample was national in scope, and data collection began back in, that must have been 2018. We call it the SEED study, Sequences of Employment and Education. And we had about 130 young adults already in this longitudinal study. They were between the ages of 16 to 25. They had a prior diagnosis of a serious mental health condition, had experienced what we consider a disruption in their school or work, or had been hospitalized because of their serious mental health condition. And this was a national sample. And we were collecting data every 4 months on their school work training activities so that we could see how those change over time. But we were also collecting several psychosocial factors and potential covariates. Not to get in the weeds of the theory, but just looking at things such as self-efficacy and vocational outcomes and self-stigma, all sorts of different things that the literature combined has showed to impact and or be impacted by school and work activities, both in adults of all ages, with or without mental health conditions. And then we had started late 2019, we had started another kind of sister study, which we affectionately call SEED 2.0, which was recruiting a new cohort of participants with some new funding that met the same criteria as SEED 1.0, but also had a prior history of foster care system involvement and or co-occurring substance use disorder. So we were actively recruiting that second group when the pandemic hit. And so as the world was crumbling, we said, we need to be studying this. How are we going to understand how the pandemic has influenced young people with mental health conditions? How are we going to be able to monitor this? And we really didn't know how long it would be going on. So we added some questions related to COVID, some structured questions that there were some shared validated measures in April, May 2020. There have since come out a lot more measures of both school, work, and psychological distress, but we decided to stick with the questions we had. And now we're starting to look at the data longitudinally to see what we're looking at. But in sum, just so you know, the sample is about 230 young adults between the ages of 16 to 25. So again, the data really looks at the impact of COVID-19 pandemic on normative, what we would consider normative career activities. 99% of the young adults in our sample who were already enrolled in school or training had in-person classes stop. Particularly folks that were doing any hands-on or experiential learning. This was everything from internships to skincare, phlebotomy, those kinds of training programs. There were 40 young adults who indicated at the time the pandemic hit that they had been involved in hands-on or experiential training immediately prior to the pandemic, and then 82% of them said that that training was canceled. Looking at the data, we weren't able to really capture how many maybe should have been doing a hands-on experiential learning in the fall, of 2020. So this is really thinking about the spring 2020 people who were already had that experience underway. And about 20% report being laid off or furloughed because of the pandemic. And let me go to this slide here. We had some open-ended questions that we're currently coding. And this isn't, you know, I'm sure many of us, well, some of us have young adults in our lives who are experiencing this, high school graduates, college. You know, it was a really difficult, challenging year for young people transitioning to adulthood. We did have a lot of young people talk about reduced hours and lost income. We had some people talk about increased hours, people who were essential workers, usually in the service industry, meaning in retail, grocery stores. But then you had the people that were waiters and waitresses, or you know, people who literally overnight were not able to work. The concept of online schooling, again, time will tell what this does long-term to college and post-secondary training. Some people really liked being home and being on online training. Others really struggled. And many had expressed instances of uncertainty or the need to change coursework. Oh, 1 minute warning already. So this is really important to think about because actually I have a new paper that came out recently based on some qualitative data. Young adults with mental health conditions were already experiencing very nonlinear school and work trajectories. They already had a lot of starts and stops, and the amount of starts and stops that they experienced during the pandemic, it remains to be seen if they're able to recover from it. Similarly, many of us, most of us can probably say the pandemic has impacted us negatively in some way regards to our mental health. And this was the same here. These are young adults who already had a diagnosed mental health condition, who then essentially reported that the pandemic and the outbreak increased symptoms of anxiety and depression. We did have about 2/3 of the sample reported that they received telehealth for mental health or substance use counseling. And again, we see this population at baseline, if you will, may have already been struggling with some of these issues, but now are reporting in our data increased substance use, irregular schedule, trouble sleeping, sometimes the difficulty of keeping a regular schedule. And then even relocating to unhealthy environments and worrying about the future. So overall, this feels like a bit of a recipe of disaster for many young adults with mental health conditions. And again, the long-term impact remains to be seen. And many young adults economically were really the hardest hit from the Great Recession of 2008. We're worried about how young adults are going to fare long-term from the experience of the pandemic. And we worry about the very vulnerable young adults, which includes young adults who already had pre-existing mental health conditions. So I'll leave it there. Thank you.